Marealis Africa Limited has launched a new product, PreCardix, a food supplement which helps to lower blood pressure naturally without any medical, environmental, or social side effects. The drug was developed in Norway and has been approved by the Ghana Foods and Drugs Authority as well as FDA USA and Health Canada. With its consistent blood pressure lowering effects, PreCardix is mainly a food supplement for healthy adults seeking to maintain their cardiovascular health, adults with family history of hypertension seeking an affordable natural solution without major side effects. Speaking at the launch of the product, Chief Executive Officer of Marealis AS, Andrea Simonton, assured medical practitioners and clients of PreCardix optimum benefits to maintain and support cardiovascular health naturally.
I think what's also important to mention here is that this is where you as doctors or healthcare professionals comes in, and where also the measuring and monitoring comes in. The first lection here was very good. The best thing you can do to prevent hypertension and to control hypertension is to know your numbers and keep measuring and monitoring your blood pressure. So whatever treatment you're taking, or whether you're adding PreCardix to medication, trying to reduce the amount of medication with PreCardix. For some people, the blood pressure stays down for a while, even after stopping taking the product. However, with most people, you have a rebound after a while if you stop taking it. So as with most medications, PreCardix needs to be taken over time to maintain optimal results.
Also reiterating the need for more awareness creation on hypertension and its effects, being currently the leading cause of deaths in Ghana, a cardiologist and internist both at the National Cardiothoracic Center and the Kolebu Teaching Hospital, Dr. Alfred Doku, urged the general public to take precautionary steps and prioritize their cardiovascular health.
Hypertension is a major problem, and it's part of the cardiovascular disease we're trying to manage, and it's a main driver of death now across the world, and hypertension is the single most important risk factor for all these. So I have this picture of Kibera in Kenya and then Nima in Accra. Okay, why these slums? That is where you have the bulk of the hypertensives across Ghana. They are in urban and peri-urban areas. The urban poor, that is where you have people who are trying to make it, trying to survive. They could hardly, afford, the basic necessities of life. Yet they find themselves in the cities. So hypertension and cardiovascular, that's the least on their mind. We have a huge burden of these conditions within the community, and that's where we should be focusing on.
Chairman for the product's launch and neurologist and lecturer at the University of Ghana Medical School, Professor Patrick Ejay, encouraged health practitioners to embrace the revolving methods of medication.
The good thing is food as what? Medicine is the future. We don't stop anti-Parkinson's, levodopa is a supplement, so we add it to it. So that's where we are going. Food as what? Medicines. So nobody should stop any ACE. So we shouldn't think of stopping ACE when we have a case of hypertension, but as a supplement. And I bet you most of your patients will love to take these food as medicines, as a supplement to improve their to improve their hypertension against increasing the doses from 20 to 40 and or adding on other medications. So let us look at the beauty of medicine. Medicine has never been an exact science.
However, contraindications for patients and clients is to not take PreCardix if one has shellfish allergy, a history of angioedema related to previous use of ACE inhibitors, has a renal artery stenosis, is pregnant, breastfeeding, or under age 18. Reporting for MX24 News, Emanuela Malkley Ano.